Welcome back to Empowered with Elizabeth Namofsky, where we're discussing empowerment on skin, nails, and hair care throughout our lives. Now, Dr. Curtis, I'd like to ask you, if one of your parents had skin cancer, should you actually worry, or is that just, indicative of that parent?
Well, it matters a little bit which type of skin cancer they had. So the most common type of skin cancer right now is basal cell carcinoma. About 1 in 6 Canadians get it. And that's really related to sun exposure. So what you will have inherited from the parent is the fair skin and perhaps the lifestyle that all of you were at the cottage together. So you're at risk for that reason. If your parent had melanoma, that's more worrisome for a couple of reasons. First of all, melanoma is a more serious skin cancer. It's potentially fatal. And secondly, it does have some genetic loading to it. So, I will tell people first degree relatives. So, that's your parents, your siblings, or your children. A first degree relative with a melanoma is a 10 times increased risk in melanoma for you.
So if you know that, your parent has melanoma, what should you do to prevent yourself from getting it?
It's all about sun protection, because the more sun you get, the more moles you'll have. The more moles you have, the more risk you have. But it's never too late to do that sun protection. So, of course, I see lots of people who are adults, and you will have had 50% of your lifetime sun exposure by the time you're 18. So to some extent, they've already done a lot of damage. They already have a lot of moles. But I will tell people that melanoma is a 2-step procedure. So step 1, you got all that sun, you've got the moles. We can't change that. But step 2, you get sun on the moles. You push one of them over the edge. That's what you can avoid. So good sun protection is always worth doing.
So I'd like to move on to hair now. How should I look after my hair?
Well, healthy hair will reflect your general health. So again, eating well, sleeping well. There are different issues that people will have with their hair. So for example, if you have an issue with iron deficiency, that can result in hair loss. If you have the type of hair that you want to keep very, very tightly braided, there is a risk of something called traction alopecia. So chronic pull on the hair, you can lose hair, and you can lose it permanently if it goes on long enough. So it is definitely something you want to be aware of. You want to have good general health to have healthy hair. So you don't want to be vitamin D deficient. And of course, since I'm always preaching sun protection, I'm also telling people they can take vitamin D, 2,000 units a day.
So, okay, so we've taken the vitamin D. We've been, we're eating healthy, but we're still losing our hair. What's happening? Is this a bigger picture?
Well, there are different types of hair loss. So, the 3 really common ones, there's the kind where you have sudden and dramatic shedding. And people are actually quite frightened by that because they literally see their hair coming out in clumps. And that can be called telogen effluvium. And there's a bunch of triggers, basically anything that's a shock to the system. So delivering a baby, having surgery, a major stress in your life, weight loss, you suddenly drop 20 or 30 pounds and the body thinks it's a famine and it's not going to waste any resources on hair. It views hair as a frill. So telogen effluvium, that's one cause. Fortunately, it's often self-limited. So you deliver the baby, but then your body returns to a kind of a normal state and the hair loss will gradually stop. There is something called androgenetic alopecia. So that's your female pattern or male pattern hair loss. So that one is a genetic one. And you look at your family history, you kind of take an average of all of your relatives. It's not one side or the other side. It's just all of them. And if you have a bunch of people with significant hair loss, that may be something that you have to sort of take into consideration. And then, of course, there's the kind where you get round bald spots, often noticed by a hairdresser. Fortunately, the hairdressers are often quite reassuring about it because they've seen it before. It's fairly common. And that's an autoimmune one where the immune system, for reasons best known to itself, has decided that particular patch, we got to go for that patch.
Okay, so when we come back, we're going to talk about a flaky scalp and a little bit more on the hair. And then we're going to segue to nails, because you and I have talked about, getting a mani-pedi and nails and cuticles. So I know that a lot of people are going to be really excited to hear about what you have to say when, when you come back in a couple of minutes. So please don't go away. We'll be right back.